Burnout turns to healthcare workers tonight. They've certainly worked nonstop during the pandemic, leading to massive burnout all across the country. Channel 3 Waterbury Bureau Chief Dennis Valera is telling us about some new research in Boston to hopefully help them cope.
But now we're in this tug of war between getting back to business as usual and finding this place of prolonged anxiety and exhaustion.
It's been a nearly 2-year marathon. Karen Miguel has been a nurse for 35 years. In the last 20, she's been working in quality and safety at Massachusetts General Hospital, or MGH. She says while the pandemic started with exhilaration and strong camaraderie in healthcare workers, it's now turned into exhaustion.
I think nurses have seen a lot more death than they want to say they've seen in the last 2 years. And particularly the hardest hit are our youngest nurses.
Dr. Elise Park is the Director of Behavioral Research at the Benson Henry Institute at MGH.
Clinician burnout is based on people having just a sense of feeling not valued and overwhelmed and overworked.
She and her team saw red flags in February 2020 before the pandemic ramped up in the country, seeing data suggest a decline in mental health in healthcare workers in China.
We thought based on the anecdotal and data that was coming out of China that we really had to think about how do we prepare and help support our clinicians and healthcare workers at MGH.
From March to June, Dr. Park and her team had 17 groups of frontline healthcare workers go through their SMART program. SMART stands for Stress Management and Resiliency Training. Virtually, they met twice a week in sessions with mental health clinicians, giving space to talk out what's stressing them.
Frustration with not having control over your work hours, frustrations with changes going on with isolating yourself from your family.
The goal was to better their resiliency, their ability to bounce back after dealing with adversity.
And what we found was after the groups were done, people reported that they felt less lonely and isolated. They felt less emotionally distressed, they felt more resilient, and we really felt that we were able to meet the needs of clinicians during this early period of the pandemic.
Dr. Park says the study showed to prevent burnout, healthcare workers need to know what they need. That's how they'll know to see their own red flags and know how to reach out. Develop that same camaraderie they had when the pandemic began.
Clinicians need to understand that most clinicians are struggling during this time and that this might be new for them to be able to seek help in a way they hadn't needed to or really thought about before.
Miguel says in her department they followed a similar model to what Dr. Park did.
We organized quickly and started to realize that time and space were the two things staff needed. They needed time to talk and the dedicated space to be able to share, be heard, be validated.
The response there, also positive.
When they're doing what they believe is good and right and they have what they need to do their jobs, then they take care of the patients.
While it's important to have group support, Dr. Park says healthcare workers need to cultivate individual support too. She suggests an exercise routine, a healthy diet, or even meditate. In Boston, Dennis Valera, Channel 3 Eyewitness News.
Dennis, thank you. Now, coming up tomorrow, we will shift our focus to how burnout is affecting college students. For many, the adjustment from remote learning to living on campus was certainly a challenge. We'll talk with a counselor to learn some specific ways students can cope.